Hi, everyone. This is Tori Vandelin with Prevent Connect. The podcast you're about to listen to is an excerpt from a web conference we did in November 2021. It's called Trauma Informed Principles Are for Everyone, Supporting and Sustaining Sexual and Intimate Partner Violence Prevention Practitioners. Additional information about the web conference can be found linked on this podcast page on our website.
I'm so excited to introduce you all to our next guest. I want to introduce you to Courtney, Brooke, and Katie, all from the Virginia Sexual and Domestic Violence Action Alliance. Courtney, Brooke, Katie, welcome. Thank you for being here. I'm going to hand it over to you, and I'm wondering if you could first tell us about the project that you all are working on called the Underserved Populations Learning Collaborative. From here on out, UPLC. And I will hand it to you all.
All right, thank you. I'm going to start us off. I'm Courtney Kellixt. There's my pronunciation of my last name. So yeah, I want to talk to you all about the project that we've been working on. As you said, the Underserved Populations Learning Collaborative. What I'm going to do is frame kind of like the background of the project and how it got started. And hopefully you could pick up some of those trauma-informed, culturally responsive, racially just things that we did in the process of making the project. So as you can see on the screen here, the mission of the project is to support local and domestic violence programs and sexual assault centers to become strong allies to underserved populations and to promote access to culturally responsive, comprehensive services. Now, this sounds really survivor focused, and it is, but there's a good portion of the project that is really focused on organizational change. And you hear more about that later. So while this mission seems really important, you'll hear more from Katie and Brooke about the meat of the things, but I'm going to tell you about the bones of it. So before we got to this mission, as I mentioned, can you change to the next slide? I'm sorry. Before we got to this mission, I would like to say that some folks from our agency, the Action Alliance, are funders, the Virginia Department of Social Services and their Office on Family Violence and the Department of Criminal Justice Services. Their victim service division came together to discuss this partnership before it even became a project. And I mentioned that the Virginia Department of Social Services and VDSS, you'll hear me say that, and DCJS, Criminal Justice Services, there are funders. I have to say that because they funded the project, but in making this project, we decided to become, in some ways, very equal partners in construction. So that speaks a lot to that collaboration piece when we're doing this hard work and having the hard conversations. So prior to January 2018, before I got onto the project, folks, they were talking, leaders in our agencies, respective agencies, were having conversations about the needs assessment you see up here, the results of that needs assessment, and the results of the sexual assault demonstration initiative and the best practices there. And they were also talking about who's getting left out of accessing services. And when I came on board the process in January, we hit the ground running, and that's January 2018, of course, and to talk about what our partnership could look like, what we were researching models of how we were going to do this, then we figure out what bones of a project could look like. And then that's how we came to the mission you saw on the previous slide. We developed that, and we developed learning objectives, the format, and we determined that folks should really get a stipend for participating in this to limit the barriers they may have for travel to this project. So we did all of that, and then what you see on the screen here is kind of like the model that we created. There's like, it's a 24-month project. It started out at 18 months. We got probably to I want to say at the 12th month, and we were like, look, we are teaching on people all these things, but we need to walk them through some of the concrete things they could do. So we added another 6 months. So now it's a 24-month project. And what we were hoping kind of like the meat of it, just to outline that, is that we'd be asking agencies in this 24-month project to dig deeper into trauma-informed, culturally responsive, and racially just practices. And that's not just for the clients and survivors they serve. That is for them to focus on that internally as well. Because we know that sometimes the things that happen in our agencies also mirror to the way we serve survivors. So I wanted to highlight some of the influences, but not go too deep into them because you'll hear about that later. So the National Network for Trauma and Traumatic Stress, Child Traumatic Stress, they have a learning collaborative, and we borrowed that model of having a cohort-based learning collaborative. Just like I say, we took some lessons learned from the SADI and the assessment tool. And I didn't put it up here, and I don't know how I forgot it, but we also used the framework of the 3-tier population framework from the Women of Color Network, and that really guided some of the work that we needed to understand the project. So yeah, the last little bit, the format, 24 months, is loosely based on the social ecological model, doing internal reflection, community work, and internal like personal reflection, internal or agency reflection, and then community level work. And I'll also say that this cohort, this is our second and last cohort, and our funders and our agency are part of the cohort. So we're trying to get to that outer ring, like larger policy, larger statewide work that needs to be done with that racial justice and so trauma-informed practices as well. I think that's it. I think that's all I have for the bones of things.
Thank you so much, Courtney. It's so great to hear kind of how you all, the process that you went through and who your influences were and what the project actually, the format that it follows. So thank you so much for sharing that. Really appreciate that background. I'm wondering, so I know that in our conversations, UPLC is really intentional about addressing the cultural, racial, and gender aspects of being trauma-informed. So I'm wondering if you all would talk a little bit about how addressing equity has shaped this project.
Yeah, I will be taking this little portion of the conversation. Thank you for advancing the slides. Hi all, I'm Katie Moffitt, and I apologize, my dog hasn't made a peep until just now, so I'm hoping he quiets back down. So there are several ways that we have rooted ourselves in equity. So a little bit of the why. Back in 2008, there was a survey done, and the report that came out was increasing Virginia's capacity to serve culturally diverse survivors of sexual and domestic violence. So in this, they really were able to identify local programs' readiness to engage in this work. They found that about 51% of respondents already had some kind of written commitment to addressing racism in their mission or in their values. But then the 41% who didn't, of that 41%, 75% of folks said, but we want it to be there. So in that survey study, they were able to identify the readiness that was brimming to the surface for folks in this state. Next slide. Then, Courtney, I got you. Women of Color Network. We were in conversation with them as partners and also pulled from portions of their STOP project, in which they identified the 3-tiered system for identifying unserved, underserved, and inadequately served populations, which are historically marginalized populations throughout our country and in our state. And what they found in this project, and what we've really tried to emphasize, is that a one-size-fits-all approach does not work. It will not reach, it will not impact, it will not empower or uplift folks if you're addressing everyone with the same formula. So next slide. And then to build on that, 2014 and 2015, there was a statewide needs assessment of unserved victims of sexual and domestic violence in the state of Virginia, which dug a bit deeper and went further into identifying what those common barriers were across the state. And so I'll just quickly go through those. Really, there's a distrust of SDV response systems in the state due to adverse personal or historical experiences with the response system and service providers. People identified a lack of coordinated, consistent, reliable, accessible, affordable, or culturally appropriate services. There's a perceived or actual consequence for disclosing SDV result, which resulted in them receiving or not receiving help. And then there was also a sense of minimization of issues across the state. So that's a little bit of the why we focused in on equity. We realized that in order to end violence, we have to work towards equity. So next slide, please. Yeah, because if folks aren't
Katie,
sorry. Yeah.
No problem. Can I just ask, when some of our conversations was really about like this idea of a culture shift. And so I'm wondering what kind of culture shifts were you all hoping to see through UPLC?
Yeah, so actually this next slide really feeds into that. So what we're really hoping, and Courtney mentioned earlier, that we're hoping that people will do individual work, organizational work, and then, bigger societal community level work. And part of that is working to dismantle white supremacy. So we want folks to examine implicit bias and racism and the connections that those have to uplifting and supporting the continuation of sexual and domestic violence. So if we're going to end sexual and domestic violence, we must end racism. We must address and deal with implicit bias in ourselves, in our organizations, and in our systems. It's got to go all across the socio-ecological model for this to be effective. Next slide, please. Yeah, so just really big here. I want to emphasize this: anti-racism work is anti-violence work. We had that question at the beginning about how do we fix like the broken culture of work, and I immediately just wrote down dismantle white supremacy. That's what we got to do. When you think about that pyramid, when you think about the rate pyramid and all of the isms that support and allow domestic and sexual violence to continue, at the base of that is racism. We have to deal with that. And if we don't, we're not doing the work. Next slide, please. Yeah, so again, challenging those characteristics of white supremacy. A resource that we've used and distributed amongst both cohorts is the Dismantling Racism Works workbook that you can find online. It highlights the characteristics of white supremacy by Tema Okun, and walks through not only what they are, like perfectionism and either or thinking or only worshiping the written word. Not only does it like challenge those, like point them out, but it gives you ways to challenge them within yourself. And then how can you do that as an organization? And then even as you work out in the community. Next slide. Yeah. So again, you saw in the beginning, things around trauma-informed care, SAMHSA's 6 principles: safety, trustworthiness, peer support, collaboration, empowerment, and choice. And then we find that often the 6th one is the one that doesn't get as much attention. The fact that if we are doing trauma-informed care, if we are in fact weaving this into the fabric of our programming, that we must be addressing and taking into account cultural, historical, and gender issues. And next slide. All right, so here are some of the shifts. I'll pause for a second.
Hey y'all, I'm Brooke Taylor. I use they, them pronouns. Thank you, Katie and Courtney. So to finish us out, we're gonna talk about some of the expected culture shifts that we're looking for from the UPLC project. And again, this is taking place across the state of Virginia based upon the Sadie. It was influenced by the Sadie project. And so the first thing that we're going to talk about, we really hope to see organizations highlighting or preferencing those who are most impacted and have oftentimes marginalized communities have the least amount of access to services. And so one key tenet of the UPLC project is to go out and really do outreach to folks that we don't typically reach within our STVA organizations. And so this can also be a sensitive subject when we're talking within our organizations, because what does it mean to be more impacted when we're all survivors, right? Like we're dealing with a community of survivors. And so that's actually a question that comes up within our work, is to say like, well, if we're out doing outreach to new populations, what happens to the people that we were already serving? Are we supposed to neglect the folks that we were already serving in favor of new folks? That's definitely not what we aim to do. But we are acknowledging that historically, there have been communities that have been consistently marginalized. And within our field, it's our duty to reach all survivors. And so one of the key hopes of the UPLC project is to shift the culture in that way, where underserved populations are no longer underserved, and we're providing a more equitable service across the board. And so if you could go to the next slide, please. Yeah, so simply put, we need to, when we reach out to underserved populations, we need to trust that those communities and those survivors know their needs best. Sometimes as practitioners, we can have the arrogant nature of believing that we know better than the communities that we're serving. And one thing that we found within the project is, our communities are resilient. And we talked about that word resilience earlier. So whatever words you would like to fit in there, our communities know what they need. And if we actually build true, genuine relationship with them, they will tell us what we need once they trust, what they need once they trust us. And so building those trusting relationships is a key component to what we do. And we also trust the communities to say, hey, this is what we would like, this is what we won't, what we don't like. How would you like our organization to work with you? Not this is what we're offering you. There's a big difference between those approaches. If we could go to the next slide. So Katie and I are gonna discuss this last slide with you all. Some of the lessons learned, and again, we are in our second cohort. We're about halfway through, maybe a little more than halfway through the second and last cohort. And so we've learned a lot of lessons thus far. So number one, the importance of being nimble or flexible. This work causes us to have to constantly readjust our expectations. It causes us to constantly question whether we are doing these things for the right reasons, and if we're not, how to get back on track as an organization. We have to dig deep. This is tough work. Relearning how we approach people professionally and in community takes a lot of soul searching. It takes a lot of honesty, not just individually, but collectively as an organization. So it's deep work. And we definitely encourage our participants to be kind to themselves, but also to be real with themselves, right? Both are very important. We don't want to excuse behavior that can change, right? And then organizational shifts. So one of the interesting things that we've seen thus far is organizations that came into the project thinking, oh, we've been doing this for years, like there's not really a lot we can learn from this. Some of those organizations were the main ones that needed like top to bottom restructuring, right? And not in a bad way, but just to say, hey, we're looking at our practices and we see that there are things that we need to do differently, right? And so being aware that, we all know about strategic plans and everything, but sometimes you may find you have to go away from the strategic plan to say, hey, 3 years ago, this made sense, but where we are in community right now, we're going to have to reevaluate. And so, Katie, do you want to take the last three?
Sure, I can. Thank you, Brooke. So other lessons learned is that I think, Madison mentioned earlier, like thinking about like that notion of community, and community can be your organization. So I just want to highlight that too. So when you're centering the voices of community here, that also means the community that makes up your organization. And so how do you center the voices of those on staff, I think is important. But also when we're thinking about the communities we're engaging from that 3-tier, how are you centering their voices? How are you collecting those voices? Is it just a survey that then sits in a strategic plan and a binder on a shelf, right? Or are we actually making good use of those things? Are we partnering with community, and are we allowing them to lead the work? Or are we going in and checking off grant objectives? I know I used to be funded in a prevention program, and there were a lot of those deliverables like 10% of people increase their knowledge by at least 15%. Is that really what the community wants and needs? They don't know. They don't need that. What they need is for us to listen and support their efforts, lift their voices, and allow them to lead the process. So those are really big lessons that have been learned. As a coalition, as participants in this process, we have learned that we also still have a lot of work to do, that we have to be continuous learners, lifelong learners, and that even though we're coalition staff, we are not necessarily experts, and often aren't. And so again, it's important for us to go to community and allow them to lead and collect their voices, and then do the jobs of uplifting them and funding them and supporting them. Yeah. I don't know, Courtney, do you have anything else to add to that?
I think I would add one thing, and that is the importance, the odd nature of like working with your funders on such a thing. When we're talking about culture change, also the people that you're partnering with, you have to be somewhat on the same page, even if the pace of change is at a different pace. Like at the coalition, something that we learned is that we may be able to be more nimble and dig deeper, but with our partners, the conversations might have to keep going, because they may individually understand where we want our agencies, our member agencies to go, but they also have barriers to face when they're trying to push these things down the line. So yeah, conversation is very important as a lesson learned.
Thank you, Courtney. Yeah, that also highlights, just again, conversation being incredibly important. A lot of our teams in the first phases spend a lot of time in conversation, and that has proven to be really rich for folks. And we had one organization actually decide as a result to level their power in decision-making processes in their agency, and that's been pretty cool to see too.
I mean, I want to thank you, Courtney, Brooke, and Katie, for sharing about this project. I think that it's really neat to hear about a project that sets aside a full 2 years for folks to go through a process that ultimately will hopefully have a big impact on not just the ways that they engage with community, but like you said, I think, Katie, like the ways that they engage with community within their own organization. And Tori, I want to pass it over to you, because I know you want to go back and ask our guests another question.
Yes, I do. Thank you, Ashley. What do we need to sustain ourselves in the movement? What do you all need to sustain yourselves in the movement? Courtney, Brooke, and Katie, if you're comfortable sharing that with our audience today.
Yeah, I'll go first. So yeah, I think that we are all feeling a high level of burnout. We talked about the Great Resignation earlier. I don't know who hasn't considered joining the Great Resignation. I don't know where the meetup group is, but I'm trying to find them. So yeah, I think that for me, longevity in this field and within advocacy as a whole, it takes a lot of personal grounding and recentering. I think that you have to be able to check in with yourself and figure out what your own personal motivations for this work are. And without knowing that, it won't be sustainable for you. And there's nothing wrong with that because the work is difficult. But for me, finding grounding is very important. Vacations are important. Take your PTO. And so, yeah.
I'm going to go on and say community care. And when I say community care, I mean find yourself some allies that get it and are willing to put some, if you are a person with a marginalized identity, find those people who are willing to step up and do the work and give you some chance to rest, rotate out whenever you need to. Like Brooke said, make sure you take time off. And I would also say, like, work on the root causes. Don't shy away from them. If you got to put that at the center of your work, that's what you got to do.
Yeah, I mean, really just echo Courtney and Brooke is, take your time off, find your people. I think I heard a talk from Tarana Burke a few years ago, and she was really just like, find your people in the work, and the power of meaningful relationship and meaningful collaboration. And meaningful, having a variety of definitions, but things that like feed your soul and move this work forward. So,
yeah, I want to echo all of that. And I think one thing that has been helpful for me and also for folks that we've worked with and that sort of thing is also recognizing and owning our worth, within this great resignation, that we are valuable as individuals, as employees, as coworkers. And so recognizing that within that value there, we are then deserving of self-care. We are deserving of time off. We are deserving of love and respect. And that includes from the community that our organization is. So not being afraid to ask or sometimes demand that when the situation calls for it, through having that community of people and recognizing that we have a lot of value and power within our organization has been really helpful for me just in the last 18 months.
Thanks for listening. Follow along with other Prevent Connect podcasts at preventconnect.org/podcast.